So I got my scrub brush and I open the tap and get ready for scrubbing. And now I'm just rinsing and letting the water drip, and I go down to the prep room, open the door, put on my gown and then gloves. I make sure my gown is okay. With my right hand, I give the tie to the runner, my left hand keeping the other tie secure and tying it. I give the list of our main set, which is the pump set. I checked for holes and opened it. And now we're going to be counting. So I'm removing the 4 green corners, and there you can see I adjusted my sleeve so that I can move better. Shout out to Mr. T Banks for setting me up in this occasion. So that's the 2 split eye probes and blade lock hook, the 3 pump sucker ends. We also have the Papworth retractor, and you can see that I made a small rectangle right there where I put the green corners and the backends or brocks. It's just my style. So I checked for the screws and it's working. Oh, you see there are 6 screws, it's working. And then I put my wire stuff there. I was counting dispenser wells, 15, Dunhills, 2, 4, 6, 8, 10, 12, 14, 15 as well. And now the mosquitoes. You don't have to count it in this order, but and tubing clamps 4, mosquitoes 2, 4, 6, 8, 10. And as I was saying, you can count in whichever order you like. And master of the pump set 2, 4, 5, and 2. So 5 Roberts, 2 O'Shaughnessy. Needle holders would be 9, and we will check all the tips of the needle holders, make sure they're intact. So I check it with the runner. There's a little chip, but it is okay. Next are the clamps. So we have 6 clamps which will be named, so that's for you to master what are the names. So 2 Rampleys are there, 7 towel clips, And we go to scissors 2, 4, 6, and 8. All have different names as well for you to learn. So 2 liga clip applicators, checking the tips, screw, handles are all intact. And 6 forceps, 2 short, 2 long debay keys, 1 Makindo and 1 lanes, 1, 2, 3, 4, 5, and 6 BP handles. And we've established that it's complete. And since we are doing an aortic valve replacement, we have the valve pack. And as you noticed, I opened the side that is closest to me, and it's to protect my sterile gown from touching the non-sterile table. I scoot it aside, take my pump set, and put it on the table. I just flip it like that, open it, put on the runner's edge. So I ask my runner to arrange my table in such a way that the borders are facing away from me, so that when I push something it won't fall. And my runner can now safely open everything on the table. So my main goal when setting up is to cover all my tables, do my mayo stand. So as you can see, I'm opening and just making sure my table cover is squared. And I'm gonna I'm gonna drape my mayo stand. This is a bit tricky, which comes in practice. So up down technique from me. Push the one up and then down, and then tuck it in nicely so that it's not loose. As you can see, I use both my hands to do it, because as Mr. Wells has said, setup is everything. I readjust my gloves. I threw my rubber bands there, as you can see, which I use for different occasions. So I just set up my bowl nicely, take out my jugs and separate 2 and 2 and all my pots. So 1 jug there for the normal saline. I put my blue bowl there, and goodbye paper. So I take the BP handles that I need, and then at this point I'm just gonna set up the table. As you can see, the runner is opening stuff there, and experienced runners open stuff in a particular way, wherein they try their best not to disturb the scrub nurse while they're setting up, because there are things that you give out that you open and then the scrub nurse will have to take it just for safety reasons. So I put all my forceps there. Now keep in mind that there are many ways to set up, and as you go along you'll find your way. And you can see me there just choosing the right kind of scissors, because the Nelson scissors, it's much more thicker than so that's what I've left there, because it's much thicker, and we need a finer one to dissect or to cut, but it will depend on the surgeon's preference. And you can just see me opening stuff. So one key is to one key principle that I keep in mind is that to touch one thing at least just once. So when I touch it, except for counting, when I touch it, I arrange it and just leave it there. So it's kind of like set it and forgets it. Let me leave it there. And my runner just drops things in my sterile field. I don't mind. So as you can see, a lot of movements there, but I would say no wasted movement, so I'm not going back and forth with one goal. So when I move, I make sure when I touch something, I deal with it, and then I place it in a place. So as you can see there, my runner needed my help in getting these. So these are what we use for snugging. In the past we had pre-cut snuggers, but now they just don't come with the pack anymore, and we make them. And as soon as I've taken them, I've cut them already, and I'm just counting how many snuggers I will have to use. And for this case, just 6. And I just measured it in line with the probe. And I know one will be shorter. Let's see. So I make sure the next ones are about the same length and not very short. Because the deep purse strings, for example, the one for the SPV vent needs a longer snugger. And comes my second runner from break. Shout out to Nicola. And I'm gonna give them a kidney dish to open this, where they can open the sutures. So I choose my needle holders. I tend to put everything that I will need on my main working trolley so that I won't be turning around back and forth as the surgery goes by. So I'm now in my Roberts. Put all my Roberts there. My right angle, I tend to keep them there because the surgeon doesn't use or won't use tapes at this point. So I just arrange my Dunhills, all the heavy ones or the bigger ones at the back, because I use them for the snuggers. So all my tubing clamps will go there for cannulation. My mosquitoes there, but that's not their final place. And then when I'm happy and satisfied with my pump set arrangement, I leave a space there. I put on my blue towels just to cover it so that I can arrange my drapes. So as you can see, the last drape that I will use, I will put on the bottom, and then I will look for the tape. So there's my bag clip and my bag just for my rubbish. So as you can see, the principle of touching only once. So when I've touched it, I know I don't need it. Then I just realized that the valve pack has a yellow diathermy. Surgeons, they want the yellow one. Some of the newer packs come with the purple one, which they don't like. And it's because of the flexibility of the tip. So going back to the drapes, so IOBAND and then tape. And then I put my drapes there. Yep, bear hugger. And then my gloves. Then at this point, I'll make a drape for the patient's groin because we want to cover their private parts after prepping. So there are also many ways to do this. This is just the way that I got used to. So as I put it there, I will put a tape just to tape it to the patient, and I put my prep and then my prepping glove on top of it so I don't forget to put on my second pair of glove as I am about to prep. So they've opened my saline. We need it for testing the suckers. I give that away so we don't need it. So my other blue towels for the valve replacement stage later. And then I just quickly prep my table. My suction, there's a connector which I will use later, and just quickly twisted it. I didn't realize it wasn't on the right spot. So I have my yanker sucker. I connect it now rather than later. I put on some towel clips on my quivers, that right there, to secure them later. And then I just put some stuff under my pump set. Open my sharps pad. And I put my shods there to be cut later. That's not a priority to be cut at this moment. And then put on my blades. Now in occasions that I know that there might be an emergency, like if I expect or I sense that we might need to set up really quick, I put on my blades first. And I've accidentally left something there to be opened, but I don't need, so I've just given it out. And then just give out the lists for checking. And this is a very good practice for the runner to open the saw last, because that should be on top. Because as I've said earlier, if we need to open quick, the first thing that you will need to use are the blades and the saw. So I tighten it, making sure that it's safe. Put on the guard, tap the hose, put on the hose, and make sure it's on safe. It's on safe mode, so even though if I press it, it won't activate. And I just tuck it in there. Okay. And I give the list to the runner, and we have the aortic valve set. Throw that away there. I take a kidney dish for my Dunhills, 2, 4, 6, 8, 10, 12, 14, 15 Dunhills. The sets will come to you in time through repetition. And we have the leaflet retractor, the Rezano. I'm just showing Nicola the forceps and the set as well, because she's a relatively new to cardiothoracic surgery, so I make sure she learns the set as well, because it's being checked by the scrub nurse and the runner, and showing her the angulation of the rongeurs and how it's used. So I give that to the runner. I open the Denver wells, or our sternal retractor. We have the retractor, and I just close it, check the pin, load it, check the next pin, load it. Now we have shallow and deep blades, and for this particular patient I chose to use the deep one. And we have 4 balls. Now these are used for mitral valve and tricuspid valve repairs or replacement. The H, the key, and the rakes. So if you see the 4 balls, to its left is what we call the pillar. And what I do is I just lay them down alternately, so not only that it looks nice, but to help in choosing. Once the retractors need to go in. And I take my Perceval sizers. Now we have 4 sizes: small, medium, large, and extra large. And I check them because you'll never know if it got mixed. And I personally took the valves earlier, so I know that they're there and they have the right date and they are safe to use, because there are indicators there that says if they're still okay to use or not. And the collapser is being opened to me. I just open it. It's just a big piece of metal that houses the collapser, so that's just the base where I need to assemble the Perceval later. So I just check and then I will be ready to count in a moment. Counting takes maybe just a minute. And I'm just removing all the small parts that I don't need. So that's my CO2 line. And now I'm ready to count. So 1, 2, 3, 4, 5, and 6. 2, 3, 4, 5. Then 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So I count them by 5s because they are packed by 5s. 1, 2, 3, 4, 5. And try not to count on top of the pile. So 1, 2, 3, 4, 5. So if you made a mistake, you're sure that what you've repeated or what you've counted is correct. Then my style is to put those red ties on a Dunhill. Next, needles. So 2, 4, 6, 8, and so on. So as you can see, I have 2 pots. One pot is for my needles that have, so my packet with 2 needles, and one is with the single ones. And it helps me in segregating them in whatever I would use them for. So I have my bone wax there, very important after sternotomy. So there was one asking me there what stage they're at, and then I'm telling them maybe 5 minutes they're ready. So I just put my liga clip there, which we use for ligating bleeding vessels. And then I just make sure everything's okay. So I count my snuggers. I show it to the runner as well. Don't just tell them, show them. And if you're running, you need to see. And I have my shots. And there are many ways how to prepare this. Some might not agree with me how I prepare it, but it's the quickest way I've seen. Cut them and then put them in the mosquitoes. And then after that, they will be ready and we will be ready to check the patient. I tend to check the consent outside when it's on the patient on the WHO checklist. I'm just saying, I've said earlier the blades which my runner has seen and my pump sucker ends, we don't have some things, and hopefully we could record one for preparing cabbage, wherein we will prepare the leg set and or a radial set or an EVH, preparing for an EVH. And that's it. And I hope you find it useful, and if you have any questions or comments or suggestions, please do let me know. I'm open to all suggestions and how to improve and perfect the practice. So see you next time, and I'm sure anesthetic team is ready because I've seen the bar. That's the last thing they put before they say that they are indeed ready. See you next time, and happy scrubbing.